Don't trust AI to correctly diagnose you. Here's why. In this video, I'm going to show you why you should not rely on AI alone to diagnose yourself. Hi, this is JJ. Welcome back to my channel. Currently, I work in urgent care, treating sick walk-in patients. There are three reasons why you should not rely on AI tools alone for your medical concerns, and instead you should consult well-trained healthcare medical provider for their opinions. First and foremost, you're not able to provide AI all the relevant medical information. Without getting all the right information, AI will not be able to optimize himself. AI is only good as whatever information you provide. If it's not able to get some information, you will not be able to analyze that part of the equation. Not only you have to provide current medical symptoms and medical issues, but also past medical history, chronic medical issues you're dealing with, medications you're on, allergies, and all the lifestyle stuff, such as you smoke or drink and how often. All those do factor into coming up with medical diagnosis and stuff like that. I'll show you what I mean by what pops up when I type into ChatGPT. So here we are on ChatGPT website. You can either type the website address directly, chatgpt.com, or Google ChatGPT, and then click on the link and you'll get here. You don't have to sign up. I do have an account, but when I'm in a clinic, I'm too busy sometimes to log in. So I just go here and then type in the prompt or whatever information I'm looking for, and then normally they generate an answer for me. So whether you're a clinician, medical practitioner, or future patient looking for any medical information, I'll show you what kind of information you can feed and how that can help you gather some information. So the patient was 62-year-old male, had lower leg pain for 2 weeks. He said that he started up from his right hip thigh area and then it's coming down to his right ankle. He tried ibuprofen and Tylenol, that hasn't worked. And walking around seems to make it worse, so sometimes he sits down and tries to rest. And 2 days prior to him getting the leg pain, he did out extensively, a lot more than usual. And then he does have history of hypertension, and he's on amlodipine. So let me type in some prompt, and you guys can take a look what I put in, and then we'll see what the ChatGPT generates. Secondly, AI is not able to pick up your overall visual and physical impressions. They're not able to see how you walk, how you talk, and how you're built. Also, they're not going to be able to pick up all the focal physical findings, all the subtle physical clues. And all those things can add up when it comes to coming up with correct diagnosis and medical treatments. I'll put in some physical findings I saw and see how AI, specifically ChatGPT, helps narrow it down for us, okay? Second thing AI lack is being able to um, determine the overall physical visual impression and know his physical findings. Okay, so this did have a couple findings. Notice was that he has some blister-like rash that was going from his right ankle to right thigh area, and those blisters were grouped. This could be shingles. I saw the rash and I'm thinking shingles. I'm like, wait, is the pain related to shingles and the fact that he may have some muscle pain? Is that just a red herring? Or maybe he does have both muscle pain and for some reason he did have shingles too. But he never mentioned that. If you relied on AI, you would have had shingles and you would have never known. Sometimes the reason AI alone cannot be relied on for medical diagnosis is that AI is not able to do any follow-up investigation. In the clinic, when I finish with collecting information, finish with the physical exam, I go back and see if there's any missing information, if there's any additional information I need to gather. I follow up with patients and ask follow-up questions. Order, appropriate labs and do other, imaging studies that would help provide additional clues. AI is not able to do that. I mean, he can recommend few stuff, but he's not able to properly come up with the solution for you. Okay, let's again put some information into ChatGTP and see if they would further refine the answers for us. Yeah, and third reason I rely on AI to give you medical diagnosis. Well, yeah, they're not able to do follow-up investigation, and sometimes that can mean something. So let's get back to this generated the differential diagnosis. You see here, DVT, deep vein thrombosis. What that is blood clots. And anytime someone has a leg pain or swelling, you should consider that. I looked at the physical exam. On physical exam, so I did the physical exam on him, but when I saw his legs, there was no swelling. Remember, except for the rash that I mentioned, there was no swelling. It was, yeah, left leg, right leg. And usually with DVT there is a swelling, so I'm like, I mean, another thing you have to do when you're practicing medicine, especially someone who has some emergency medicine experience like me, you have to try to rule out something that's gonna cause. Also, when you're seeing patients in the clinics, especially if you have some emergency medicine experience like me, you have to always think diagnosis that if you miss, if it's gonna cause irreparable harm, it's gonna cause serious medical issues for the patient. So I was like, okay, let's ask him some follow-up questions. Remember something? So I asked him, um, okay, did he travel recently, or had recent surgery, or any history of blood clots that he can think of, or is any these blood clot issues running in his family? And he did say he traveled 5 days before he started having pain, and he said he was on airplane for 6 hours, and as right after he got off airplane, he had to ride another 5 to 6 hours uh, on a bus. So yeah, pretty much he said he traveled uh, sitting down mostly for 12 hours. Huh. And I was thinking to myself, does long distance travel possible chronic immobilization? So he does have testing to make sure that he doesn't have a blood clot. And I did order the lab test, D dimer. Let me see if they do recommend that. Uh, there, if needed, D dimer, DVT suspension, right there. So I ordered that, and it's come back. If and guess what? This also 2 times the normal value, D dimer. So I called up and explained to him. Yeah. So now do I really have? Shingles, is it muscle strain, or is it blood clot? I know this is a thing. So I told him, look, you do have a risk factor for blood clot, DVT, and you do have a rash that's consistent with herpes, and maybe because you were on a long 12-hour travel and you didn't get enough sleep, and your immune system was down, maybe that's why you reactivated uh, the herpes virus. Yeah, and yeah, he did have a chickenpox as a kid. You had some muscle strain. Yeah, and I even asked him other follow-up questions, like if you relied on AI. I was in the military before. You would have had shingles, and you would have never known. Yeah, it's not common. strenuous workout, even in the hot sun in the summer, and a lot of running. Sometimes even they ramp it up. So this is common. I've seen that some patients hospitalized get IVs for those. And I mean, he didn't get blood in the urine and other stuff. He didn't. So yeah, and while we ordered the labs, the other stuff to look for it, and he didn't happen to have it. So in summary, personal health is not black and white, and AI can only help as much as whatever information you feed them. In summary, AI tools such as ChatGPT should not be solely relied upon to come up with medical diagnoses. AI can be used to obtain important medical information, but it should not be a substitute for healthcare professional who is well trained. As I showed in my videos, you need to know how to properly feed relevant medical information, do the physical exam and provide relevant findings, also be able to do follow-up investigation and provide additional information after. In the future videos, I plan to do more screen recordings of utilizing AI to answer clinical and medical questions. I hope you guys really liked my video. Please subscribe and press like, and see you guys next time.